The Albanese government is backing a wage rise for aged care nurses, with the Fair Work Commission reviewing pay rates for the sector. Let's bring in Ian Yates with the Council of the Ageing. Ian, always appreciate your time. Thank you. We are awaiting details from the Fair Work Commission, but what is your expectation as to where this pay rise will land? Are you expecting increases will be phased in over several years?
Good afternoon. The Fair Work Commission has had this case before it for a while. What has happened now is that the Commonwealth Government, the new Commonwealth Government, has made a submission to the Commission indicating its position, which is that it supports a significant pay rise. It does so for a variety of reasons, including that the complexity of the work has increased over the years, that the regulatory environment has increased over the years, which is what the public expects, what the Royal Commission has recommended, that the frailty and illnesses of many residents has increased over the years as well, and that probably the wage rates that were set in the past never fully reflected the value of this work to our community. So all of those reasons, and also that in fact reflects that largely both in terms of nursing staff and in terms of the vast majority of staff who are personal care workers, that this is an overwhelmingly feminised workforce, and it has not received the value it does because it's a feminised industry. So the Commonwealth has put in a quite substantial submission to the Fair Work Commission saying, it supports a significant increase. The unions have sought an increase of 25%. The Commonwealth doesn't say a figure. It says that's for the Fair Work Commission to determine, but it does support a significant increase. It says the award in the past has got it wrong, and it's certainly wrong now. And then really importantly, the Commonwealth has committed that whatever the Fair Work Commission gets to as an answer, that the Commonwealth will pay it. And that's important because, of course, the Commonwealth Government is the principal funder of both residential and home care in Australia. So that's where we've got to. The Commission will hopefully, it has to go through its normal processes of reaching a decision. We, of course, in the sector and amongst consumer organisations, hope that the Commission will come to a decision sooner rather than later, because the workforce challenges facing aged care are enormous. And while wage increases won't solve that, you won't be able to solve it without increased wages, because we are just not attractive to people to come and work for financially.
And we know that skills shortage is only exacerbated over the years of the pandemic. What is your assessment of how we are handling the current COVID wave in the aged care sector?
Well, COVID has put enormous pressure on the sector, but as you correctly point out, this sector was facing workforce pressures before then. A very major report that I and others were involved in 2018, released in 2018, charted a way forward, and we haven't gone too many steps along that way yet. So government needs to act, the industry needs to act, but the Commission needs to increase those wages. Now, it may be that they recommend an increase over several stages. I would hope that those stages wouldn't be too drawn out. The aged care sector is having difficulty competing with, say, NDIS and with the health system. All the care professions are having difficulty. The Commonwealth estimates that the workforce in aged care needs to grow by at least 6.6% per annum over the next 5 years, and probably beyond that, on top of the fact that there are over tens of thousands of vacancies right now. So the situation is quite dire, and the Commonwealth's support for this wage increase, I think, is really a pivotal development.
Ian Yates, we appreciate your analysis, and we'll be watching that very closely to see where the Fair Work Commission lands. Thank you so much.
Thank you.